Hello and welcome everyone. Today our topic of discussion is uterus and cervix. In this video, we are going to discuss about anatomy, histology and pathology related to uterus and cervix. Introduction. The uterus has an inverted pear shape. It measures about 7.5 cm in length, 5 cm in width in its upper part, and nearly 2.5 cm in thickness in adults. It weighs approximately about 30 to 40 grams. There are four parts: body, fundus, isthmus, and cervix. The body gradually narrows from fundus to isthmus. The cavity of body is a mere slit, flattened anteroposteriorly. It is triangular in shape. Anatomically, uterus is located in female pelvis, immediately posterior to bladder and anterior to rectum. Several ligaments support the uterus, including utero-ovarian ligament, round ligament, broad ligament, cardinal ligament, and uterosacral ligaments. It is further supported by pelvic diaphragm, urogenital diaphragm, and perineal body. The most common position of uterus is anteverted and anteflexed. Anteverted means cervix angle forward, and anteflexed means the uterine body is flexed forward. The cervix is fibromuscular organ that links the uterine cavity to vagina. Although it is described as being cylindrical in shape, the anterior and posterior walls are more often ordinarily opposed. The cervix is approximately 4 cm in length and 3 cm in diameter. The cervix of parous woman is considerably larger than that of nulliparous woman. The cervix lies between bladder anteriorly and bowel posteriorly. Laterally, the ureters are in close proximity, as are the uterine arteries superiorly and laterally. The main blood supply to uterus comes from uterine artery, which is a branch of internal iliac artery, and the drainage done by uterine vein, which drains into internal iliac vein. Most important aspect of carcinoma of uterus cervix are lymph drainage. The fundus and other parts is drained into periaortic and para-aortic lymph nodes. All other parts excluding fundus drains into external iliac lymph nodes and superior inguinal lymph nodes. The cervix drain into external iliac lymph nodes and sacral lymph nodes. Let's learn about uterine physiology. It involves menstruation, pregnancy and birth, and menopause. Menstruation is a shedding of endometrial lining occurring monthly in the reproductive age females. The uterus provides nurturing environment for fetal development and contracts during the labor to facilitate the birth. The menopause marks the end of reproductive capability as the uterus undergoes natural changes in the menopause. Now let's learn about histology. The histology of uterus divided into three parts: endometrium, myometrium and perimetrium. The endometrium composed of mucosal lining in uterine cavity which is made up of endometrial glands and stroma. Myometrium is a smooth muscle tissue which makes the structural wall of uterus, and serosa consists of loose connective tissue in outermost layer of uterus. The endometrium has a two different part. First is basal zone and second is functional zone. Functional zone is subdivided into spongy zone and compact zone. During menstruation, the functional zone shed in the menstrual blood. This picture shows 28-day menstrual cycle. The first 4 days are of menstruation. Ovulation occurs at 14 days. After ovulation, luteal phase start. There are few structural changes occur in glands and stroma during whole 28-day cycle, which are following. The first phase is menstrual phase, which is from day 1 to 3. The key feature of menstrual phase is stromal crumbling. The stromal aggregates, blue balls, and hemorrhages are observed in stroma, and the glandular epithelium are collapsed, and few displaced secretory glands can be seen. The next phase is proliferative phase, which is from day 4 to day 15. The key feature of proliferative phase is mitosis. The stroma is loose, but mitosis is observed in the stroma. The glands are straight to lightly coiled, and mitosis are also seen in the glands. Next phase is secretory phase. Day 16 called interval phase, where subnuclear vacuoles are seen in the glands, but they are irregularly arranged. Mitosis are observed in both stroma and glands. In early secretory phase, in day 17, the subnuclear vacuoles in the glands are arranged regularly, which gives the piano key appearance to glands. The stroma is loose and mitosis are decreased. On day 18 of early secretory phase, there is addition of supranuclear vacuoles. So, subnuclear and supranuclear vacuoles both are observed at day 18. In a mid secretory phase, that is day 19 to 21, the key feature is stromal edema. Here, dilated glands and irregular outlines of glands can be seen. There are luminal secretions in few glands are also observed. In late secretory phase from day 22 to 24, the key feature is focal predecidual changes around the spiral arteries. The gland's appearance is sawtooth like. In the late secretory phase from day 25 to 28, the key feature is predecidual changes involving the surface. First it is focal, then it is extensive, and the glands show prominent sawtooth appearance. Now let's learn about histology of cervix. Cervix has a several different lining. The endocervical canal is lined by glandular epithelium and the ectocervix is lined by squamous epithelium. The squamous epithelium is uniform, stratified and non-keratinizing. The stroma of cervix is composed of dense fibromuscular tissue through which vascular, lymphatic and nerve supply reaches to cervix. The next is squamocolumnar junction. The squamous epithelium meets the glandular epithelium at the squamocolumnar junction. At the upper end of cervical canal, the endocervical epithelium becomes endometrial lining of uterine cavity, and in lower half, the cervix lies at the top of vagina where squamocolumnar junction is present. The SCJ is dynamic, moves during early adolescence and during first pregnancy. The original SCJ originates in endocervical canal, but as cervix everts during this time, the SCJ comes to lie on the ectocervix and becomes the new SCJ. The epithelium between these two SCJ is called transition zone and its position is also variable. The squamous cervical cancer accounts for majority of cervical cancer and originates in transition zone, and glandular cervical cancer originates in either transition zone or glandular epithelium above transition zone. Let's learn about pathology related to uterus. First is non-tumor pathology. It includes abnormal uterine bleeding, adenomyosis, endometrial metaplasia, endometrial polyp, endometritis. Second is pathology involving tumors. First is carcinoma. Examples are endometrial carcinoma, clear cell carcinoma, endometrioid carcinoma, serous carcinoma, undifferentiated carcinoma. Smooth muscle tumors, which are leiomyoma, leiomyosarcoma, and stromal tumors and mixed epithelial and mesenchymal tumors. The cervical pathology are non-tumor pathology, which are inflammatory and infectious conditions like actinomycosis, candida, bacterial vaginosis, chronic cervicitis, chlamydia, CMV, HPV, and benign lesions like atrophy, endocervical hyperplasia, endocervical polyp. The tumorous pathology involves pre-malignant lesions like adenocarcinoma in situ, HSIL, SIN 1, 2, 3, malignancies like squamous cell carcinoma, adenocarcinoma, other mixed epithelial and mesenchymal tumors. These are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.